Hi, I'm Town of Islip Supervisor Angie Carpenter and want to welcome you to our latest edition of Supervisor Spotlight. And I am so delighted to have with us today Dr. Eileen Gortz, who is a physician here locally on Long Island in East Islip, right here in our wonderful town of Islip. And Eileen is a obstetrician gynecologist. And so let's talk a little bit. We're going to talk about a lot of things, but I want to first of all find out, so when you were a little girl, did you always want to be a doctor?
Okay, so I came from, my mother was, I was a late in life child. She was just about 40 when she had me. And my sister was 16 and my brother was 12. And their routine, my mother went back to college in her 30s and became a guidance counselor. She was the first one from her family to ever go to college.
Oh, how wonderful.
And I think she always wanted to be a doctor. And my sister went to medical school and is a psychiatrist, and my brother is a physician and an internist. And as I grew up, it was, where do you go after you go to elementary, middle school, high school, college? You go to medical school, and then what are you? A doctor. And I would be 4 years old with a little story.
Oh, isn't that cute?
So
that's adorable. So you knew.
I knew.
So you knew.
And I
so
loved it.
What made you go into the specialty that you went into?
So I wanted to, I loved talking with people. I wanted to be a psychiatrist. I loved the surgery and I loved the medicine. And OBGYN gave us the ability to do both. Mm-hmm. It gave me the ability to counsel patients and take care of their health. I also had that my sister always said that she wished she was a gynecologist, and she was my big sister, and I said, well, I could do it.
That's great.
And loved it. I have not a day of regret. I love being a doctor. I love taking care of my patients, and I love how it makes me feel as a career. I'm so gifted and privileged to be able to take care of women.
The career of medicine, I would imagine, and just going for recollection over the years, female doctors were not as prevalent as they are today. Female obstetricians and gynecologists were not as prevalent as they are today. So did you find it a little bit more difficult as a woman getting into the field of medicine?
Well, I was very lucky that when I did one of my rotations, all of the residents just happened to be on this one group, were all women.
Wow.
So I saw them cry. I saw them get frustrated. I saw them have to deal with intimidation. And I saw them take care of patients no matter what, and have husbands and children and live their lives. And I really felt that that really led me on the road to be able to pick this job. I think as I got into OBGYN and upper level programs, university programs, a lot of them had women. In my year, we were 4 residents and 3 were female.
Wow.
So it was the change was starting. And now I go to conferences, and it's a lot of women are doing OBGYN.
Yeah. So it has to be a lot more reassuring in talking about talking to people for women to have a female doctor. It's very personal. Your physician is very personal, especially for a woman. So it gives you that opportunity to really put them at ease and know where they're coming from.
I think that really helps a lot. Women really, at least in my practice, well, first of all, they're seeking me out because I'm a woman, especially early on. Though I had a male gynecologist, and he was an OBGYN, and he was wonderful to me.
Me too.
Okay, and I totally could relate to him, and he was kind. But I think it's a different time, and especially that a lot of my practice now, I just do gynecology, and my practice has been geared more towards menopause, though I do take care of daughters, and so I do a lot of adolescent and teenage, and I see lots of college students and people who are not having babies at this time yet, and then I see their mothers and grandmothers. So that part of the practice has evened out. But I think women, certainly at certain times of their life, get a little frustrated, or they're just frustrated with healthcare in general, and they just need a new way, and that's where seeing a woman like myself comes in.
Yeah, that's wonderful. I don't know that, when I first started seeing a gynecologist and an obstetrician had my children, that I really had the option. I can't remember that there was a female available. But I, too, was very blessed and very lucky with the male gynecologist obstetrician who was very kind and understanding and able to, I felt comfortable talking to, but that's not always the case. So women are luckier now in a lot of ways, So
yes, we have choices.
we have choices.
We have choices. And I think the key is to just find somebody who's listening to you, and especially now with frustration with healthcare, you have to find somebody you can talk to. And you have, especially during COVID recovery, you have to have patience when you go to the doctor, because just like going into a restaurant, everyone is nervous, everyone is not on their game per se in being calm, because the anxiety underneath the mask is a lot. And
I'm glad you mentioned the mask, and we are being socially distanced here today, and we have our masks when we came in the room, just so anyone is wondering out there. And you know, I don't mean to trivialize it at all, but it is so important. You know, wearing the masks is so important. It's a little thing that we can do to help spread or help stem the spread of COVID, which is just a horrible, horrible virus.
And I have to tell you, I had COVID. I'm a survivor with my husband. We both lived through it, and we're here to talk about it. But we still wear a mask just to be courteous, supposedly, because who knows when something will change, though it's unlikely now that we're going to see, we're likely to get a reoccurrence, which I'm very happy about. But we wear a mask because it's the right thing. And also, we're going to decrease flu. We may see a lot less colds, because now if you have a cold, like somebody in my office had a cold and they didn't come to work for the week because you have to wait to get your COVID test.
Exactly.
Because it's very hard to differentiate flu, allergies, and COVID.
And, you know, I've had that conversation. Dr. Chris Rayo from Good Samaritan Hospital has been on the show a number of times, especially during this whole COVID dilemma. But I think that we're going to see an easier flu season in the fact that the spread of the flu will not be what it might have been in years past, because just by very nature of how we live our lives now, you know, you wouldn't dream. I was in a store the other day, and they had like 10 cashiers set up, and they had broken it off with walls every 2, and they were only having one person go in to where you would normally have 2 people. And yet when I first approached the cashier I was directed to go to, there was someone standing there, and I couldn't believe my reflex reaction was, you know, I can't go there. And I didn't, you know, think I was that anal about it, but I guess I am.
No, I think it's important. But remember, it's not, we're wearing a mask, we're social distancing, we're washing our hands, we're Purelling, we're wiping down things, and we're being conscious that if we're not feeling well, we hope that we're not going out and that we are respectful of that.
Let me just interrupt, because I'm going to have to take a little bit of a break, but we will go on with that, and I thank you for watching, and we'll be back in a few moments with Dr. Eileen Gortz.
You are watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. I'm Angie Carpenter, Town of Islip Supervisor, and just want to do a shout out to Long Island News Radio 103.9, who is very gracious to run our shows and allow me to have the privilege of having guests like Dr. Eileen Gortz on the show.
Thank you.
And we were talking before the break about COVID and wearing our masks and doing the things that we need to do to make sure this does not spread. And there are things that we need to do, you know, that are COVID specific, following the guidelines and everything, but it doesn't mean that we put our lives on hold, because we had talked earlier about taking care of yourself and doing the things that we need to do routinely, that when COVID first hit and we were all like quarantining those first couple of weeks and everything, I know I had an appointment scheduled for the periodontist, and I'm like, oh, well, I can't go now, you know, and it was easy to cancel that appointment. And, you know, 1 week goes into the month, and months go by, and some of us have not followed through with some of that routine preventative maintenance that we should be doing, the preventative medicine.
Well, I think that we're going to touch on it a little bit. This is October, Breast Cancer Awareness Month, and I think we have to be aware of our health again, and we have to get back to it. Because from mid-March to early June, people really stopped taking care of themselves and stopped doing important things. Like there's some kind of statistics out there that 30% of patients who had real symptoms of breast cancer did not go for their follow-ups, did not, even if they felt a breast lump, they delayed everything and they were really scared. And I'm very worried about down the road, the delay in diagnosis, because we always say early diagnosis leads to the best outcome.
Outcomes, absolutely.
And you have to get back to your routine. You can't be afraid, but you can be cautious. And I think, again, we'll say it over and over again. Wear a mask, wash your hands, use your Purell, stay your distance. Even in my office, we have signs everywhere to stay 6 feet apart. Don't get frustrated when you go someplace and they check your temperature and your temperature is 100. Then maybe you don't know, you don't feel, maybe it's an error, maybe it's not, but you come back another day, because right now we're still in a pandemic. And it's not over. And we should not relax about it. And that way you'll know when you do go out, you don't have to be nervous. So you can go to your internist. You have to get your blood pressure checked. If you're due for lab work because of medications that you're on, you have to get it done. And you shouldn't be afraid to go out. I think that's probably one of the regrets we will have, is how we said don't go out, but we didn't say, but continue on with your important health care. Like if you're due for a follow-up mammogram, don't not go. If you're due for, during the COVID quarantine, I did remain open because we didn't want gynecology patients to go to the hospital, because 99% of the patients were positive. So we tried to handle things in the office, and maybe we did things a little differently, gave different kinds of medications just to avoid patients going to the hospital. Even our breast cancer patients, some of them chose radiation or chemotherapeutic treatments instead of having surgery, because we really delayed a lot of elective surgeries as much as we could. And now we have to get back on track. But now it is really important, no regrets, go to the doctor. I mean, one scenario is I did have a patient, and I've had many that were home and bleeding very heavily, and she was very upset, and I was like, but you need to come in. She goes, but it's COVID, I can't go out. I'm like, but you have to come in. And she was very anemic, and we had to institute therapy immediately. And I have to say, my support in the East Islip community is amazing. We have amazing GYN oncologists in the area, and doctors who really, and other gynecologists who stood the test, stayed in the hospital and took care of patients who were COVID positive. But now it's time to regroup, get back on track.
And it goes for all the disciplines in health.
Absolutely.
You know, and whether it's going to the dermatologist or the dentist or the cardiologist, whatever, you just cannot, put it off, because there are certain situations where putting it off could make a difference in having a positive outcome or not.
Absolutely. This is the time to regroup in a safe manner, because the pandemic's not going away, and you can't wait a year. You can't wait. Waiting 3 months and 6 months was maybe too long for a lot of patients. And your mental health, because I think I don't know anybody who doesn't have a lot of anxiety. Wearing the mask all day at work, in every discipline, whether you're in a food store or wherever you may be, your doctor's office, or your building here. Yep. Being conscious about your behavior takes a lot on everybody, and it's okay to have that anxiety and seek help. There's tons of, now with the best thing I think that came out of this COVID was telemedicine, because patients do not all need to come into the office. And you can see, I was using a computer program called Doxy.me. Now I have Doximity on my phone. I can FaceTime with my patients, and that really works. And I think that's helped a tremendous, and I think a lot of patients are really appreciating that. And you can do that for mental health care as well.
There are a lot of positives that have come out of the unfortunate situation of COVID, and certainly telemedicine it was in place before, thank God, but it really enjoyed a resurgence, if you will, and people really embracing it. But people should also really appreciate and understand the fact that almost every single, medical office, whatever it is, has put those protocols in place, have put the, shields up, have the masks, are taking temperatures, meeting people out in the parking lot,
Absolutely.
whatever it is, they're doing whatever it takes to create that safe environment for their patients. So, it's not something, and I'm speaking from experience, who wants to go have a mammogram, or who wants to go, go to the dentist if you can avoid it. And COVID became a convenient excuse for putting some of those appointments off, but there is no excuse, and you really, really need to do what's right for your own health and that of your family.
Right, and especially colonoscopies and everything. I just recently went for my own mammogram. I went to the breast center at Good Sam, and I was very impressed. I came in, a woman greeted me, she took my temperature, and some places will have different temperature cutoffs, so don't get frustrated. Took my temperature, and then I went right into the room. I changed. They immediately came for me. They put me into the room. It was very clean, safe. The doctor came out and told me what my results were, and if I needed a sonogram that day. They were able to do it, not always, because the places are, all breast centers are having their own issues because of spreading out the number of patients that are coming in, but the care was amazing. In my office, I was lucky because I owned 2 units, so I just doubled up my staff and spread everybody out so everybody could be 6 feet apart because everybody was so anxious. Bought a ton of the thermometers. So we could take care of it. But it's a work in progress, and we're constantly changing, also because patients are so used in my practice to just saying, I have a problem, coming right down, but we really are being cautious. And then also, it's so hard, and you have to remember this, you're not supposed to bring extra family members with you, but they could still Zoom in, they could still FaceTime, and if it's really that important for you to have that extra family member, call ahead, talk about it with the doctor's office so they're accommodating, because we're working on a certain number of bodies in a square footage. But you can still get your health care in person and feel good. And I'm going to tell you, people feel good coming out because it's like the first time they've gone out, especially if they were getting food delivered to their house and they're really nervous.
Yeah, it's true.
And even the patients now who have lost their health insurance, the doctor's offices are working with them. There are many radiological services that are available, and everyone understands that we're in crisis mode.
And because of that, they are really going above and beyond. I really have seen that time and time again. So, and we're very appreciative of that. We really, really are. So I think we're going to take a little break and be back with Dr. Gewirtz on Supervisor Spotlight.
You are watching ITV, Channel 18, Islip Television.
Hi, this is your Town of Islip Supervisor, Angie Carpenter. Welcome back to Supervisor Spotlight, and we are delighted to have with us today Dr. Eileen Gortz, who is a renowned, I'm going to say, you are, gynecologist in the area. So many women are just so pleased that you're there for them in their time of need and even in the time of preventative care, which we were talking about earlier. And talking about preventative care, we are right now in the month of October, and I'm not sure when this will be airing, but whether it is October Breast Cancer Awareness Month or November or December or whenever, if you're due for a mammogram, get that mammogram. And Dr. Gewirtz, please tell us how important that preventive care is in breast cancer.
Okay, so we made tremendous strides in diagnosing many more early breast cancers, and because of early breast cancer diagnosis leads to the best outcome. And I'm very worried that if delaying your mammogram because you're nervous about COVID and the pandemic may really change the stages of breast cancer that we may see down the road, where most of our stages, we were hoping were always going to be stage 0 and stage 1. But if people are missing their mammograms and missing their follow-ups and not following up if they have a breast lump or a change in dimpling in their skin or bloody discharge from their nipple or a breast abscess or swollen lymph nodes under their arms, we're going to really see a change in our stages of breast cancer that we diagnose. So don't delay. And then patients also shouldn't be afraid to go for consults, go for second opinions, because this is really an important time. Breast self-awareness is key. It's our new terminology instead of breast self-exam, but I still believe in breast self-exams, because if you know your own breast, you will pick up something probably more than you may get sometimes on a clinical exam, which is okay. With that said, it is really important to get back on track, and I think it's October. This is not just our country, this is an international breast awareness program that we've been very lucky to share with many countries, and it's time for us to get back on track. But included in that is going to the dermatologist, especially if you have a family history. It is going for your colonoscopy, especially if you have a family history. It is seeing your medical doctor and finding out what are the tests that you need to have done if you're at risk for heart disease and hypertension, getting your blood pressures, medicines adjusted, especially if you got nervous during COVID when they said certain medications may make you more likely to have a problem with COVID. I think it's time to get back on track, and I can't reiterate that enough, that this is where we will make a difference in the future, and for our children, and find out, especially for your elderly relatives, that they're getting back on track, not to just write them off and say, oh no, you can't go out, you can't do that. And I think, again, I mentioned before, mental health. It's really on the table now. If you're having anxiety and you're not doing what you're supposed to be doing or feel right, it's a time to reach out for help, even if it's via telemedicine. The other thing I just have to mention quickly is just about genetics. You know your family. I'm very big on gene testing. They have made it very easy for us, especially during COVID. Pre-pregnancy, patients can go speak with a genetic counselor over the phone via telemedicine. They send the kits to your house if you have risk for ovarian cancer, breast cancer. We are doing lots of doctors' offices are doing the tests, and the genetic programs are open in the hospitals.
You know, you use the term self-awareness. We really, if you pay attention, know your own body better than anyone. So don't ignore those signs that something is amiss. Don't just dismiss it, because, again, the difference in time can make a world of difference in the outcome, whether it's heart or stroke or cancer, whatever. You know, if something isn't right, don't ignore it.
As I might have mentioned, that 30% statistic that people delayed taking care of their breast issues is a huge problem, because that's something that affects you long term. And I think we're going to regret, again, that we made it, that we stopped healthcare, essentially.
Well, we stopped a lot of things, you know, but there was so much unknown, and there still is so much unknown about COVID. But what we do know is to wear your mask, stay 6 feet apart, wash your hands, and wash your hands, and wash your hands.
Yes.
You know, it seems so simple, but it makes all the sense in the world. It really, really does.
Absolutely. I totally agree.
Good that we're in agreement. That's a very good thing. I want to just one more time touch on the fact of the breast cancer awareness for the month of October. And this is something, when you said that this is not just us, it's worldwide, where the focus is on awareness and testing and mammograms, et cetera, but the one thing I want to remind everybody, this awareness really had its birth here on Long Island with the West Islip Breast Cancer Coalition, and now Islip and many other coalitions, Huntington too, and 1 in 9, the program at Adelphi University. I mean, it all blossomed, but a lot of it began, in our town, in the town of Islip, with the Breast Cancer Mapping Project, which started in West Islip.
Which you were such a big part.
Well, I was a part of it, but
and bringing that to the table, because that's what I learned at one of our meetings last year, that I didn't even know how Lorraine Pace got started with you, and where you brought it, and how it got to Good Samaritan Hospital, and where it went from there.
Well, you know, you talk about community activism sometimes, and it pops up in the strangest ways, and just being involved. you can make a difference. You can make a difference in your community. You can make a difference in your county. You can make a difference in the world. And I think the women that were there in the beginning with the breast cancer movement, Jerry Barish, Lorraine Pace, Carol Baldwin, Joan Therese Hudson, who was head of Women's Services in Suffolk County at the time, and being willing to, step outside the box and try to make that difference. It's amazing. It truly, truly is amazing. And you see it all of the time in what you do. And we can't thank you enough for what you do.
I'm truly privileged and blessed to be able to do my job and give to the community. And it is a wonderful thing to be able to do that. And especially during COVID, when I felt so isolated, being able to do things that were positive, even if it was an extra phone call for a family, trying to arrange some things that you would think that I would never be involved in. It felt so good to be involved. And I think as you're feeling isolated, thinking about community, and something that I have to quote you, you said, we're all in this together, but
6 feet apart.
This is very powerful because you're not alone. And I think the community, people in the community need to know that, because so many people feel so isolated and are still feeling that way. But getting out and doing just a little bit of community service in some way, whether it's writing a letter or volunteering, making phone calls, or whatever, you can do things even from your own home.
And you said phone calls. We're in this world of social media right now, and everything is, electronic, and Facebook and Twitter and TikTok and Instagram, etc. But pick up the phone, call someone. I did that last night for someone, and she's like, "Oh my God, I can't believe you called." And it just really felt so good. And it doesn't take much. It really doesn't take much to, a lot of times we'll have all good intentions and then life gets in the way and you don't follow through, whether it's sending someone a note or picking up the phone and calling them. So let's do that. And the takeaway for me today, I've been to many events commemorating breast cancer awareness this month so far. And I keep saying to myself, I have to call and make my appointment because I'm late. So I'm just making myself a promise right now that when we're done here today and I can get to a phone, I am going to call and make my appointment. And if anyone out there is watching and listening, please do the same.
Do the same. When I went to the Pink Flags, where we saw it for Good Samaritan Hospital with the West Islip Breast Coalition, I went the next day. That was on a Sunday, and Monday I made my appointment.
Well, see,
and
all those
done.
Good intentions. So we had the Good Samaritan Pink Flags, and then we had Northwell also too, and we are so blessed to have two really first-class hospitals.
Oh my God, so lucky.
So,
we are blessed.
but everyone's in there. We're there for one another. And Dr. Gewirtz, thank you so much for being here. And
So an honor and a privilege. Thank you so much.
We'll see you next time on Supervisor Spotlight. Thank you.